Thank you for being here on this important piece of legislation. I'm Deputy Albany County Executive Phil Calderon. We're meeting in the Cahill Room of the Harold Joyce Albany County Office Building, for the record, 112 State Street, Albany, New York. This is an Albany County public hearing in regard to Local Law J, notice of which was provided in a legal notice published in the Times-Union, one of the finest newspapers anywhere, on December 18th, 2014, and in the Evangelist, also another fine newspaper, on December 18th, 2014. If enacted, Local Law J will authorize Albany County to protect infants and children from harmful effects of unnecessary exposure to toxic chemicals. The hearing is being held in accordance with the Municipal Home Rule Law. We're here to receive public comment on this local law and to permit individuals to make oral statements and presentations. Each individual will be allowed to speak for 5 minutes, and we're now assembled for that purpose.
I'm confident that others tonight will focus their comments on the scientific impossibilities inherent to the measure, but I am no scientist, nor do I represent an industry interested in selling products that are harmful to consumers, especially children. We commend those advocating in favor of this legislation. They're sincere and tenacious, and the Retail Council appreciates the good partnership that we have with them on a variety of issues of mutual interest. We disagree strongly, however, when it comes to Local Law J, its drafting, its content, and the strategy behind it. The measure wrongly burdens Albany County merchants with wholly unrealistic new standards of product compliance required, to our knowledge, by no other locality in the United States. It threatens stiff penalties against local stores that have no role in the decisions made by manufacturers. That underscores one of several fundamental problems underpinning Local Law J, the misguided notion that retailers will be empowered to go to every link in their worldwide supply chains and demand manufacturing changes based on the law of a single county in a single state. This will not.
The substances targeted in the bill occur naturally in our world, and because of that, it's virtually impossible to eliminate all traces of them from products. Understanding that achieving a zero threshold is unrealistic, the regulators have typically set limits to keep consumers, including children, safe. For example, the Federal Consumer Product Safety Commission determined after an extensive study that a low limit, 0.01%, for lead in products used by children under 12 is protective. Yet the pending bill claims there's no safe level. The federal standard is achievable and enforceable, while the county proposal is not. Second, these substances are already in household products that we use regularly and safely.
Rates of many of these problems have risen with the influx of untested chemicals into our daily life. And children are more vulnerable to the effects of these chemicals. They eat, breathe, drink more, pound per pound, than adults do. They explore their world with their hands and with their mouths. My 10-year-old daughter shoots daggers at me every time I say this in public, but I have to remind her on at least a daily basis, just take something out of her mouth. Kids put things in their mouths. And studies on, they also bring more of their environment into their bodies. So studies on flame retardants, when they've tested moms and toddlers, have actually found that toddlers have on average 5 times the levels of flame retardants in their bodies than mothers do, even though they're in the same environment. Kids are simply more exposed. And kids' bodies are changing rapidly. For young children and those entering puberty, they are going through critical windows of development, times when even small changes to the chemicals in their bodies can shape the health outcomes for them for the rest of their lives. Low doses matter to developing bodies.
I'd like to briefly focus on what I believe are a couple of the potential protections of the law, and most importantly, the claim that Albany County, and I believe that the County Executive McCoy raised this, that Albany County won't have the resources to enforce this important law, for example, for doing store inspections and testing. I'm talking about this based on my experience for 6.5 years as the attorney for, and also ultimately the counsel for the New York State Consumer Protection Board, an agency that no longer exists. It's been merged in, but at the time, it was charged with monitoring consumer protection issues and advocating for the concerns of the state's consumers. Based on this experience, I just want to say it's unfortunate, but there are few, if any, consumer protection laws where there are close to adequate resources to monitor violations through, for example, regular inspections. So respectfully, while I wish there were more resources in enforcement for consumer protection and environmental laws, that's simply not a valid argument. against consumer protection, environmental regulations. If that argument applied, we'd have to frankly wipe most of the certainly consumer protection laws that are not covered by any particular state agency off the books.
A state who has not implemented a chemical ban, and this is why we're here now, or a list, is the state of New York. Fiscal is one of the many reasons that they have not passed a law. There's 28 business groups opposing this piece of legislation. So you've got a state that's implemented who have a department that's opposed it because of fiscal, and you have a state that's not implemented it because of the fiscal. So there is definitely, it's not bogus, it's definitely a valid argument. Chemical regulation is already subject to numerous federal environmental and safety regulations under a variety of laws, including the Federal Hazardous Substance Act, the Consumer Product Safety Act, the Toxic Substance Control Act. The U.S. EPA is in the best position to craft protective regulations and to enforce them in a global marketplace. We also believe assessing products safely is more than simply noting the presence of a chemical substance in a formulation. It must include considerations of use, exposure, functionality, as well as the unintended consequences of removal of a chemical of a product. I know this was discussed earlier. I just want to reiterate again that Local Law J sets a zero threshold for prohibited chemicals. So our members that produce materials used to make useful products can contain a trace of one or more of those chemicals. So even though the definition is applied to children's products under age 12, and there are exceptions, there is still room for more that can be included in that bill. I mean, it's you know, you've seen the papers, it's children's toys. However, if you look at the definition of the bill, you could go to the eye-resistant, shatter-resistant glasses, children's party supplies. That's intended for children under age 12. You know, if you go into a department store and there's a little makeup section for little girls, the plastic on you know, makeup, is that included? And that goes to the fact that how is Albany County going to enforce that? How is your staff going to be able to enforce that? And just on talking a little bit on the enforcement, former speaker said, well, citizens can call in, you can have consumer complaints. Well, the bill says that Albany County has to enforce it, not citizens. So that's the third point in the bill, is that it's up to the Department of Health to enforce it. And at the end of the day, it's going to be really challenging based on the definitions, based on the cost, and based on the enforceability.
I'm not an expert on this, but you know, I think consumer demand is high, and increasingly high these days for safer products, and I think families want safer products. And I think it actually, not being a business expert or anything, but I would think it would increase competition, because I've also understand that globally and locally, like more and more companies are getting on the bandwagon with safer chemicals and supporting safer chemical policies based on, you know, polls and just the fact that there's a list of global companies and also local New York State companies that are supporting these safer policies, and there's really strong support out there. So I think that you know, kind of sooner or later, kind of the companies that aren't, you know, supporting this will kind of get almost pushed aside. So you can almost get a competitive edge if you have these policies.
Since chemical manufacturers are not currently required to develop even basic safety data for their chemicals, the onus of research goes down the supply chain, is on the user, oftentimes a small business owner like a children's toy store owner or a daycare provider who interfaces with the product end user. Because of the lack of adequate hazard information publicly available, these business leaders must blindly make product selection decisions, as there is no way to determine toxicity by looking at the products. Reports of unsuspecting items such as a breast cancer bracelet or Matchbox car, these are items that were identified by Clean and Healthy New York to be toxic, to have toxic chemicals in them. Having these items out there erodes consumer confidence and gives the advantage to companies with the ability to ensure that they only carry products that contain safe chemicals. There is widespread small business owner support for safer chemicals and stricter regulations, The marketplace is designed by man-made products and mechanisms that reward certain practices and discourage others. Now is time to modernize the chemical regulatory framework to work towards limiting the use of chemicals that poison children and workers. National polling of small business owners across party lines shows that 90% believe that chemical manufacturers should be held responsible for ensuring their chemicals are safe.
Because with breast cancer, you never know. I asked my oncologist for reassurance, and he's like, no, it could come back decades later. Like, you never know. It can still kill you as long as you're alive. So 7 years after I was diagnosed, I gave birth to a healthy little girl. And 4 years later, another healthy little girl. Lots of little girls here in this group. They're 3 and 7 now. I brought a photo. There they are with their dolls. And they're happy, normal little kids. My daughters know I had cancer because I nursed them, I breastfed them, and I had to explain why one of Mama's breasts didn't make as much milk as the other. And I said it was because I was sick before they were born. The doctors had to make a cut to make me get better. They don't know that my cancer could come back. They don't know that I could still die. They think it's done. Someday they'll figure that out. They also don't know that because their mom had cancer, their chance of getting cancer is much higher than their friends. The idea that my disease could kill one of my daughters terrifies me. The idea that there are carcinogens, there are chemicals we know cause cancer in their toys, and that's perfectly legal, enrages me. I am so thankful and proud that my county legislature passed the Toxic Free Toys Act. I understand it had bipartisan support. It doesn't need to be a perfect law. Anybody who makes laws knows they're not perfect. They're never perfect. It's a beginning. And lots of movements and improvements in this country happen at the local level, at the county level, and they work their way up when they're the right thing to do. We need to put children's lives ahead of the complaints of stores and manufacturers. They're scared. They're scared they're going to lose money. That's why they're here. They know that, as we heard, it doesn't need to be expensive to implement effective consumer protection laws.
Substances that have the potential to have very negative, lasting effects on their developing minds and bodies. Let's take, for example, one of the chemicals that would be prohibited in Local Law J, arsenic, an element we have known to be highly toxic, dangerous for the environment, and is even classified by the International Agency for Research on Cancer as a Group 1 carcinogen. This means arsenic and arsenic compounds are known to cause cancer in humans. Yet today, in 2015, we are finding the use of arsenic in children's underwear and in children's party hats. This element, used as poison for so many years, is still being used in products that come in direct contact with children's skin throughout the day and even in the night. Phasing out harmful and unnecessary chemicals in children's products will have a lasting effect on the health of New York's children, as well as the environment.
It really troubles me that any child would be unwillingly exposed to dangerous chemicals as a result of their daily play. Parents have a false sense of security when they go into stores. They assume that what is on the store shelves has already been vetted for safety by the state or by the federal government. But both the state and the federal government have failed us. I've been to Washington, D.C. to push Congress to act, and I don't see any action coming from them anytime soon. I've been lobbying the state legislature for action, and I've concluded that, like with so many other policies that we fight for in the state capitol, local leaders really have to show state legislators the way forward. As a health-conscious consumer, I try my best to stay on top of the latest health and science information, and I'm always surprised to learn that chemicals that have been proven to be harmful and that have been banned from certain products are still being found in children's products. When that information is available, I do my best to avoid products with those chemicals that are suspect. But unfortunately, we're here today because manufacturers have been enabled to keep consumers, parents, especially, in the dark. And even the most conscious of consumers would never suspect that chemicals like arsenic, mercury, and lead are being used in kids' products to this day. We know that while overall rates of cancer incidences are decreasing, childhood cancer rates are actually increasing. Children are more at risk due to their rapid development and their incomplete defense systems. Research has documented lifelong health impacts, including cancer, allergies, reproductive organ malfunction, infertility, and neurological damage. It's really important to know what's in the products that we buy, and the only way to protect consumers is to eliminate the use of these chemicals, especially in children's products, especially in their apparel and their toys.
So first off, as I said, federal laws only deal with lead and phthalates. It only deals with toys. This does deal with children's products in general. Now, when the federal government doesn't want localities to deal with something, they say it. We're going to do this. We don't want you to do anything on it. States, localities, leave it alone. This is our law now. This is our issue area. If they don't say that, you can maybe imply it if it looks like they're trying to occupy the field in language or what have you. That's a very, very high standard to meet, but generally it is, more and more the courts have been saying, no, Congress has to say for sure this is preempted. That's not the case here. So what that means is that Congress has set a floor and not a ceiling for localities or states to protect their citizens. And we see, if this somehow was duplicative of federal law, why are other states doing this? Why is Maine doing this? Why is Washington state doing this? Why have other states taken steps to protect their citizens?